A very good morning to all. Welcome here. Today we are presenting a webinar based on the lifestyle disorders due to thyroid gland. Lifestyle disorders are the disorders that are caused due to our daily diet if there is deficiency of nutrients in our meal. Our living standards and hygiene along with our lifestyle plays a vital role in our thyroid health. So here are my team members Kanika, Shreyasi and Mehak who will let you help in knowing about the lifestyle disorders that are caused due to thyroid disease. Introduction. In this webinar, we are going to learn what is thyroid, more about thyroid gland like function, position, etc. and what are the reasons behind thyroid problems, how thyroid problem can affect our lifestyle, how to cure thyroid problems. So, my friend Mehak will make you understand what is a thyroid gland.
Thyroid gland is a ductless endocrine gland situated in the anterior or front portion of our neck. It roughly resembles the shape of a butterfly. It is also one of the largest endocrine glands, weighing an average of 25 to 30 grams. This gland has two lobes on either side of the trachea, with each lobe measuring 4 to 6 centimeters in length and 1.3 to 1.8 centimeters in width. The specific thyroid gland location is that it is located between the C5 and the T1 vertebra. The thyroid gland's anatomy has two lobes which are embedded in the posterior surfaces of the parathyroid gland. Now my teammate Shesi will tell you about the functions of the thyroid gland.
Functions of thyroid gland. It plays a major role in metabolism, growth, and development of human body. It secretes T4 and T3 hormones, which regulates weight, energy levels, internal temperature, skin, hair, nail growth, and metabolism. It regulates the rate at which body uses energy. Affects weight loss or weight gain called metabolic rate. It slows down or speeds up the heart rate, lowering or raising the body temperature, influences the speed at which food moves through digestive tract, affects brain development, controlling the way your muscles contract and manages skin and bone maintenance by controlling the rate at which your body replaces dying cells. Now, let us know more about thyroid hormones by Kirtika.
Thyroid hormones. There are three types of hormones produced by thyroid. Triiodothyronine, commonly known as T3, tetraiodothyronine, commonly known as T4, and the third one, calcitonin. Actions of thyroid hormones. It regulates the carbohydrate, lipid, and protein metabolism, central nervous system activity and brain development, cardiovascular stimulation, bone and tissue growth and development, gastrointestinal regulation, and sexual maturation. Now, my friend Kanika will make you understand what are the reasons for causing thyroid.
What are the reasons for causing thyroid? Thyroid is an autoimmune disorder in which our own immune system can lead to the death of thyroid hormones producing cells. This condition is also known as Hashimoto disease. Thyroid disorder can also caused by genetics in which mutation in gene can disrupt a step in thyroid hormones synthesis, leading to abnormally low level of this hormone. Even our lifestyle and environmental factors plays a vital role in healthy thyroid gland functioning. Lifestyle that affects our thyroid gland. Smoking. Smoking tobacco influences thyroid function, that it is related to the risk of developing both hypothyroid and hyperthyroid disease. Poor diet. Iodine. Iodine plays a vital role in this functioning of thyroid gland. Iodine deficiency or iodine in excess both can lead to increase the risk of thyroid disorder. Fats. Fats may also interrupt the thyroid's ability to produce hormone. So intake of excess fat can also cause thyroid related problem. Next one is sleep duration. Compared with sleep duration of 7-8 hours, shorter and longer sleep duration was associated with an increased risk of TSH. People who are sedentary had higher level of TSH than those who exercised regularly. According to study, if you are a thyroid patient, then taking too much stress can make your condition worse. Now, my teammate Mehak let you know about some of the most common thyroid problems.
Some of the most common thyroid problems are hyperthyroidism. This condition is caused by the excessive production and secretion of a hormone called thyroxine. Some of the symptoms include nervousness, irritability, increased suddenness, heart racing, hand shaking, anxiety, and sleeping difficulties. Exophthalmic goiter, which is a form of hyperthyroidism, is characterized by the enlargement of the thyroid gland, protrusion of the eyeballs, increased metabolic rate, weight loss, which is commonly called Graves' disease. Hypothyroidism. This condition is caused due to the deficiency of iodine, which is very essential for maintaining the normal rate of hormone synthesis and causing the enlargement of the thyroid gland, commonly called goiter. Hypothyroidism during pregnancy can cause effective development and maturation of the growing baby, which can lead to his or her mental retardation, abnormal skin, etc. In adult women, hypothyroidism may cause menstrual cycle to become irregular. Thyroid cancer. It is a very common form of cancer. However, a patient with thyroid cancer has a fairly high chances of survival compared to other forms of cancer. Typically, thyroid cancer does not cause any early symptoms or signs of the disease. As it grows, it can cause a mass or lump which can be sensed through the neck skin because it changes your voice, causes increased heaviness and trouble in swallowing, pain in the neck, and swollen neck lymph nodes. Now, my teammate Kirtika will let you know about some of the possible cures for these diseases.
Hypothyroidism treatment. Treat any underlying disorder, thyroid replacement, levothyroxine. For most common cases of mild to moderate hypothyroidism, a starting dosage of levothyroxine of 50 to 70 milligrams per day. For elderly or if known ischemic heart disease, start a one-fourth to half of the expected dose. Adjust in small increments after no less than 4 to 6 weeks. Clinical benefits begin in 3 to 5 days, level off after 4 to 6 weeks. After dosage stabilization, monitored 6 months or annually. Hyperthyroidism treatment. Radioactive 131I therapy. Medications are propyltyrosine and methimazole, sodium or potassium iodine solution, dexamethasone, and beta blockers. Surgery, subtotal thyroidectomy. Relapse of disorder is common disease or treatment may result in hypothyroidism. Now, my friend Shreyashi will suggest you some ways for a good thyroid health.
Suggestions for a good thyroid health. Diet and lifestyle changes do work in managing and controlling thyroid related conditions. Thyroid diseases usually arise as a result of poor diet, lifestyle, and other lifestyle related factors. Few changes may definitely help in managing thyroid disorders. Less sugar is equals to less worries. The lesser the amount of sugar consumed, the better life you can live. Excessive sugar consumption leads to increased inflammation in the body, which slows down the conversion of T4 and T3, thus worsening the symptom of hypothyroidism. Exercise. Exercise can assist in thyroid treatment plan by helping relieve stress, reducing symptoms of depression, and maintenance of healthy lifestyle. Exercises releases feel-good hormones called endorphins that makes us feel physically and emotionally better. Iodine is a bliss. Iodine is an essential nutrient for the body. Thyroid is quite dependent on iodine, thus lacking iodine in their diet may suffer from hypothyroidism and goiter. Intake of adequate iodine helps in proper thyroid gland regulation. Meditation. Hypothyroidism is usually associated with occurrence of depression and anxious thoughts in the patient. Meditation can be one of the effective ways to with one's thoughts and gain mental peace. Gluten-free diet. Gluten is one of the causative factors for celiac disease. Gluten is a protein which is found in foods processed from wheat, barley, and other grains. Cutting gluten from diet will help in relieving symptoms associated with celiac diseases and hypothyroidism. Control alcohol intake. Excessive alcohol consumption messes up with thyroid functions. Intake of alcohol should be controlled for proper thyroid functioning. Thank you so much for giving us your precious time and listening us so patiently. Have a nice day.